polymyositis and dermatomyositis make up similar sort of disease. Obviously, the dermatomyositis has a skin manifestations as well. So both have similar histories of marked proximal muscle weakness. So that's the motor function of the hands and things are intact, and fine motor function is intact, but actual difficulty in standing up, getting out of a chair, and central muscle wasting is proximal muscle wasting rather is the hallmark feature of it. Affects women 2-to-1 ratio, and it's really a disease which affects people in their between 30 and 60, with the mean incidence at age 50. Diagnosis-wise, blood tests will show an elevated CK and creatine kinase as you have muscle breakdown, and you do muscle biopsies and EMG studies to exclude potential other diagnoses such as myasthenia gravis, as we saw earlier. The biopsy shows perifascicular inflammation, which is pathognomonic of polymyositis and dermatomyositis, and blood tests might also show anti-Jo antibodies positive in 20% of patients, and that indicates a potentially poor prognosis and a higher incidence of lung fibrosis associated with anti-Jo antibodies at the same time. So dermatomyositis is a similar condition, but a skin manifestation at the same time. You get Grotjens papules, which come over your knuckles of your MCP and give you this roughened, mechanic-like hands, so they've got sort of these rough, scaly patches. And you can also get a helotrophic rash, which happens over your eyelids. And you treat both of them with steroids and physiotherapy. So polymyalgia rheumatica is morning pain and stiffness in the shoulders, necks, and hips, but does improve as the day progresses. It's associated with general low mood, tiredness, and possible low-grade pyrexia and systemic unwellness as well with polymyalgia rheumatica. There's no specific blood tests available, but there might be a mild raise in ESR, and it's got a high association with temporal arteriitis, which you need to make sure they don't get, as it's obviously a risk of blindness and needs to be treated with high-dose steroids. But polymyalgia rheumatica tends to improve with prednisolone. Some of the other diagnoses that you see is inclusional body myositis. That's similar to, in presentation to polymyositis with muscle weakness, but the difference with that is it doesn't respond to steroids, whereas all of the other conditions do, because they have an autoimmune component to them.